So if this were an Apple event, and just imagine for a moment I'm in a black turtleneck and I'm Steve Jobs, this would be a time when I'd say, oh, but there's one more thing. And there is one more thing. And until now, all the teams you've seen are independent companies that got their start on their own, and we found them through the application process. Either they applied or we recruited them into the program. But we also have a part of DreamIt that we call Open Canvas, and it's the way that we work with large organizations around the world, whether they're corporations or they're large academic centers, to find the innovation that's within their walls and help them create standalone companies to bring that technology into products into the marketplace. And so this next team, Haystack, is the product of our collaboration in Open Canvas with Children's Hospital of Philadelphia. And working with them over the last several months, we surfaced over 60 concepts in every corner of that organization, where there were people working on these ideas, applying them within the walls of CHOP, looking for ways to scale up and take it to the broader market. And working with CHOP leadership, figured out which of these were the highest potential in a competitive process to actually launch, and with CHOP support, make some time for the CHOP employees or faculty who are involved in this effort. And a big part of what we do is pair those individuals with seasoned entrepreneurs who have been there before, done it before, will be the CEOs of these companies, and can recruit teams and help build an actual organization to deliver at scale. So this next company, Haystack, I think is the perfect example of the power of this model. And so without further ado, let me introduce Haystack.
Thanks to Elliot and thanks to DreamIt for this wonderful opportunity. My name is Bimal Desai. I'm the Chief Medical Information Officer at the Children's Hospital of Philadelphia, and I'm also the Chief Medical Officer for Haystack Informatics, where I get to use everything that I know about electronic health records to help protect patient privacy. At Haystack, we believe that patients deserve the right to privacy, but that hospitals lack the tools to protect it. And I want to give you an example. Memorial Hermann Healthcare is the largest not-for-profit healthcare system in Texas, comprising 12 hospitals in the Houston region. They have a world-class electronic health record and a best-of-breed commercial privacy monitoring solution in place. Despite this past summer, Memorial Hermann disclosed a massive breach involving 10,604 patients that took place over 7 years, and that was perpetrated by one member of their clinical staff. One employee who had access to clinical records and who went undetected for many years, despite their commercial privacy solution. This isn't just a problem for Memorial Hermann. This is a problem for hospitals across the country. The national burden of privacy breach is something like $5.6 billion. And for hospitals and patients, this is a complete nightmare. On the hospital side, individual breach events can cost between $10,000 to $1 million per breach. Not to mention the negative media attention, possible fines from the Office for Civil Rights, and ultimately loss of patient trust. For patients, it doesn't get much better. Beyond losing their confidential and often sensitive medical data, they're at risk for identity theft and credit card fraud. In fact, your medical records are worth 10 to 20 times as much to a hacker than your credit card information. And yet your credit card information is much better protected. It's not by chance that hospital professionals and privacy professionals believe that intrusion by employees, snooping by employees, is their #1 security threat motivator. Part of the problem, of course, is that in this day and age, hundreds of people have legitimate reasons to access your chart. When you're hospitalized, it's not just your doctors and nurses, but these days it's your pharmacists, phlebotomists, case managers, billing specialists, social workers, and so on and so forth. How would a privacy professional even begin to know that one of these employees is snooping on the record? Well, the state of the art today is that they have to look at EHR access logs. This is machine data that's generated from your electronic health record that captures in arcane detail every bit of information about who accessed what, where, and when in the chart. There's one problem. There's far too much data. At CHOP, we see 100,000 patients per month, and we have thousands of employees who have access to the electronic health record, which means we generate over 1 million rows of this data per day. So when we ask privacy professionals to look at audit logs, not too dissimilar from this, Finding a breach event in a list like this is literally like finding a needle in a haystack. And commercial privacy tools don't do much better. The current tools that are out there can't solve this problem, and I'll explain why. In the universe of access events, there are dozens, hundreds of different types of breach. And commercial privacy tools tend to focus on very specific types, using clumsy rules. As an example, one of the most widely used rules today will show privacy officers a list of patients and providers who have the same last name, in hopes that you might find somebody who's snooping on a relative. This isn't really a rule of suspicion. This is a rule of convenience, because it's easy to generate a list like that. And the problem is it just doesn't work. Recall that at Memorial Hermann, despite having a tool like this in place, they had this massive breach event. Their snooper went undetected. And I can only assume it's because he didn't share the same last name as his victims. We think there's a better way to do this. We think that privacy professionals deserve a tool that highlights anomalous access and intrusion by insiders. And that's why we built Haystack. At the heart of Haystack is our behavioral and social analysis engine. We take your electronic health record data and look for patterns that indicate suspicious access. And then we highlight this for privacy professionals in a robust, gorgeous, and interactive visual display. We feature breach through lenses. These are proprietary, modular, purpose-built visualizations meant to showcase exactly the piece of information that we want to reveal to the privacy officer. The best way to demonstrate that somebody is committing a breach event is to show that they're doing something out of character for their role. So let's say I wanted to find somebody who's snooping on their ex-girlfriend's lab results to try to see the results of a pregnancy test or something. It can happen. In Haystack, the privacy professional would first log in and be presented a list of rank-sorted events according to level of suspicion. And clicking any one of these events would bring you to the relationship lens. In this graph, we represent every patient and every provider as a node on a social graph, and the arrows indicate who is accessing whose chart. There's two people on this list that are highlighted in red, one patient and one provider. And a glance to the right would reveal to the privacy officer that this employee has no business looking at lab results. Another problem that privacy officers tell us about is that they can't tell what people do for a living. And this is vitally important, because you can't call something breach unless you know what normal activity is for that employee. At an organization with 10,000 employees, this is almost impossible to do. So we make this transparent. Haystack, in the behavior lens, renders a visual display of the patterns of access for each provider in your organization and tells you how stable they are over time and how they compare to other people in the same role or specialty. Furthermore, we give privacy professionals the ability to fine-tune these rules to indicate that specific behaviors are abnormal or normal. Do you remember the snooper from Memorial Hermann? The guy who snooped on patients from across the 12-hospital network when he only worked at one. The geography lens would have identified this individual. In this view, we're looking at all the access events for a hypothetical patient, John Smith. And a privacy professional could see that the vast majority of access events occurred on 3 clinical units that they can explain because of where the patient is. But vitally, one set of access events that took place around noon, highlighted in red at the bottom of the chart, stick out because these are unexpected workstations for that patient. Privacy professionals need tools like this. And Haystack, we think, will be a force multiplier for them to make them more productive, more proactive, to ultimately take care of patient privacy in ways that they can't do today. We are very fortunate to have the backing of the Children's Hospital of Philadelphia as part of the Open Canvas collaboration with DreamIt Health. And the response from healthcare organizations to date has been incredible. I've contacted over 30 hospitals. The vast majority have indicated that they want to meet with us. We've scheduled 12 demos. We've completed 6 of those, and 2/3 of those agreed to do a pilot of our software. These are nationally leading hospitals who face the same problems that we do with privacy and who recognize the value of this. Beyond the pilot phase, our licensing model is straightforward. Hospitals will pay an initial installation charge and then annual recurring licensing fees of around $100,000, depending on the size and complexity of the organization. Given the number of hospitals in North America and Europe, this yields a total addressable market of over $2 billion. Our team is ready to solve this problem. Adrian Talapan, our CEO, is a West Point graduate, a Harvard alum, and a serial entrepreneur who has a successful history of building and exiting companies. I trained at CHOP, and I've been practicing medicine for 15 years. I've been a biomedical informaticist for 10 of those years. And my role at CHOP puts me in contact with some of the best and brightest hospitals across the country who are all struggling with the same problem. We are currently raising capital, which is why we want to speak with you. Our projections indicate that we'll break even within 1 year. In 3 years, we expect $20 million in revenue with ample room for growth beyond that. We ask you, the investment community, to help us continue this trajectory, this momentum, and to reach our goal of becoming the industry standard for privacy protection. This is the oath that I took when I graduated from medical school. It's a promise to protect my patients' privacy. In my current role, in the era of the electronic health record, and given the state of privacy protection today, we think this is urgent. At Haystack, we believe that privacy professionals deserve more, and patients deserve nothing less. And that's a promise we intend to keep. Thank you.